My name is Jennifer Brigham, and I'm a business owner nearly 3 decades. And I'm here representing the National Association of Women Business Owners, the Minnesota chapter of NAWBO. And I'm going to take quite a different approach to my facts here because I represent business. And NAWBO did a public policy survey last year, and healthcare was second only to the economy as an issue that affects our members' businesses and their votes. And in this critical time, NAWBO very much wants to be a part of the dialogue on healthcare reform. When we're talking about us as business owners, we're talking about the group that creates new jobs and ultimately is responsible for paying and or administering health insurance, which is different than healthcare, but it's the part that we get involved in. The 3 main relevant facts that NAWBO members are most concerned about is access, not only to affordable health insurance, but to health care. Cost and quality of both insurance and ultimately care. 65% of NAWBO members feel that reducing the cost of health care and health insurance is the most important healthcare issue for policymakers to address in any healthcare reform initiative. There's also concern about the strain financially that Medicare is under. Over 90% of survey respondents identified choice of plans and providers and coverage for preventive health and well care as critical to reform measures. What I want you to know, and people here to know, is that all of this information is on the NAWBO website. It's nawbo.org. There's a healthcare position that's a couple of pages on the website. Very good information, don't want to do that. But what I do want to do is share some comments that I gathered from local NAWBO members this week. And the underlying theme is, with myself and with some of my fellow NAWBO members, is what am I going to have to pay for, and will I be able as a business owner to afford to stay in business? I now am at the point where I probably cannot continue to provide health care insurance coverage for my employees. I've gone through 3 layoffs this year already. We're now just last month turning the corner and making a profit again, which I need to do to pay anybody anything. But I really don't think we'll be able to, and several other business people I know, I don't know that I can continue to offer health care coverage in terms of health insurance premium payment at all. It keeps skyrocketing and the coverage is worse and worse. So we're paying a lot of money for something people can't use. The deductible's so high, it's not a benefit. It's not a benefit, and it's not possible to do. One of our members has a list of what she says really needs to happen. We need tort reform. Frivolous lawsuits are damaging healthcare and are very costly. She cites providing healthcare for the illegal aliens in this country as a cost. Allow competition across state lines. Fix the abuse in Medicare and Medicaid. Hold the individuals personally responsible for their life choices. And drug companies need incentive to charge the same in this country for a drug as they do in other countries. Another member, and I'm reading kind of verbatim as to the response that I got. I'm completely against healthcare reform. I believe that government should have less of an influence in our everyday lives, and we should have the opportunity to make our own choices. I'm not quite sure what she means, but that's what she says. Another business owner, this bill will require that I reduce expenses to cover additional costs of the health bill, which will mean layoffs. They're requiring 72% of the individual insurance that the company pays for and 65% of the family premium. If we don't pay, they will charge us 8% tax on our total payroll. This will put many small businesses out of business.
I'm sorry.
Am I done?
Yeah,
okay,
yeah. I'm sorry. I'm going to have to be a really bad timekeeper person, just so we get through.
But
this.
I'm going to give you a copy of this.
Okay.
Yeah, please share. Everyone's welcome to share.
Let me address this
Yeah.
because this is a little different, and this, you're reflecting a big part of the debate.
Which is misinformation.
And well, there is some misinformation here. First of all, under this, with this person called illegal aliens that are undocumented aren't getting state lines. The reason that everyone thinks like, oh, if there isn't enough competition, let's get health care from anywhere else. The problem with, the reason that we don't do that is that it preempts state mandates for what the minimum coverage can be, and for minimum standards and what has to be covered. So if you want to be able to do business in a state, you can register in the state and do business in that state, but you just got to fit your standards. So this is sort of a backdoor way of the insurance industry trying to get around state mandates and what the coverage is. On tort reform, this is a very good thing that they're going to be doing in this, I believe in the Senate bill, is doing best practices. And best practices is going to be doing scientific research into, and this is a way to bring costs down. And it's basically saying these are the best approaches, these are the most successful approaches to treating something that your patient comes into. That will help physicians when it comes to being sued. Let's talk about the cost, just bring the cost down and then I'll move on. I'm sorry, because this is coming out of your time, I feel, or something. If we don't do this, the costs are going to continue to go up. And as I said about a small business, a small business is going to benefit by this plan because they're going to be able to go into the exchange or to the gateway, and instead of covering 20 people, they'll be being a risk pool of 20 people, and someone last year got breast cancer, so this year our premium goes way up. You'll be part of a huge risk pool. One last thing, and this is about small business. There's so many people that I met around the state who said, God, I would love to start this small business. I've always had an idea for it. I can't because my daughter has a pre-existing condition. And I know if I started my own small business, I'd never get insurance. Small businesses do create 80% of the new jobs in the state. We're supposed to be an entrepreneurial country. The way we do healthcare now has gotten in the way of that, and healthcare reform will end it.
Thank you.
Thank you.